Hello. Health bosses in Peterborough are being forced to make deep cuts in the NHS budget after finances plunged into the red.
In all, £27 million must be sliced from the city's primary care trust. That's 10% of its budget. Despite official promises to protect frontline services, it seems almost certain that hospital departments and GPs will be affected. Let's get the details now from Joel Mapp. Joel.
Yes, Susie, behind me is Peterborough's new City Care Centre, designed to get patients out of expensive hospital treatment rooms and into less expensive units like this in the community. And it seems the Primary Care Trust will have to do much more cost efficiencies like that now in the future. Primary Care Trust board meetings are usually fairly dry, turgid affairs, but not today. In a room just around the corner from here, this afternoon, the chief executive here dropped a £27 million bombshell. Inside Peterborough's hospital wards, in its operating theatres, its GP surgeries and out in the community, health workers are waiting to hear where the axe will fall. A first draft released today says £7.7 million will be cut from acute services in hospitals. Community care will lose £3.7 million. And there'll be £1.1 million less to spend both on GP surgeries and prescriptions. In all, £27 million worth of cuts.
Well, we wouldn't seek to push patients away from services that they need. We would seek to provide those services in the most efficient way possible, as you might expect us to do in the financial position that we're in. We will be seeking to provide cost-effective care in the community, closer to people in their own homes, in their localities, and to avoid unnecessary use of expensive secondary care services wherever possible.
But the impact on patients may well go much further. Managers have refused to rule out longer waiting lists or even job losses.
Joel, how is it that things have got so bad?
Well, they've got so bad in a very short space of time. It started amassing debts only last September of £2 million. Obviously, they've spiralled now out of control. And the PCT blames a massive increase in Peterborough's population, an unexpected increase in demand for those health services. It also says there's been unexpected increase in demand for services in the community for disabled people and older people, and that's been a burden too. But really, the major factor in this has been financial mismanagement. Managers here knew what the budget was, and they went well over it. And the former chief executive took early retirement, and the finance director resigned over it. But it seems now it is patients who will suffer as a result.
Joel, thank you very much. And staying with health, there's been a new development today in the search for a private company to run an NHS hospital in Cambridgeshire.
Yes, it's one of the most controversial debates raging in the NHS, happening down the road at Hinchingbrooke Hospital near Huntingdon. Controversial because of proposals to replace the NHS management team with a private company. It's in response to the hospital's poor record on performance and financial management. Now, if the plan goes ahead, Hinchingbrooke would become the first NHS hospital in the country to be in private hands. Well, tonight there's a new development. The race for the hospital franchise has been narrowed to 3 bidders. They are Circle Health, Ramsay Healthcare UK and Serco Health.
On the front line at Hinchingbrooke Hospital, it's business as usual. Millions of pounds has been spent upgrading areas like the medical assessment unit, where Deputy Sister Catherine Macaulay is attending to new patient Linda Gifford from St Ives.
Linda's been admitted to hospital via a GP with a condition called pleurisy, which is an inflammation of the lining of the lung. It's being treated with antibiotics and painkillers, and I'm sure she'll be out of hospital in a couple of days.
Linda's unhappy at talk of a private company taking over here.
Really wouldn't want that to happen, I must admit. I mean, I've been in this hospital several times for different things, and I've always been treated very well. No grumbles at all with the hospital, the way it's run at the moment.
Do you feel sort of slightly unsettled because of all this talk about a private company coming in?
I think it could be good for the trust. I don't feel anyone feels that their job's on the line. I think people are excited to see what will happen next.
The state-of-the-art day treatment centre, a symbol of the modern NHS in action. In one of the 24 cabins, staff nurse Jo Bunning is attending to Nick Page from Lincolnshire. He's awaiting the results of tests. In the cabins, there are trolleys, not beds.
The ethos is once the patient gets into a bed, they like to stay in that bed. And that's not to say that we don't give them the care, but they come in for a procedure, they have that done, and then they go home.
Mark Miller was parachuted in as chief executive 3 years ago, with the hospital some £40 million in debt. He's steadied the ship. But what's the score if it becomes a franchise?
The big question is this privatisation?
No, it's not privatisation. It's involving the private sector in the running of an NHS hospital, providing NHS services from NHS buildings with NHS staff.
The public rallied in support when there was talk of closing this hospital or making drastic cuts in services. Tonight, many staff seem generally relaxed at the prospect of a profit-making company taking charge. Kim Riley, BBC Look East, Hinchingbrooke.
So with an election looming, just what do our politicians think? Well, the Conservative MP for Huntingdon, Jonathan Janogly, is happy so long as the hospital does remain open. He adds the tendering process should not be dragged out to avoid staff and residents' confidence being damaged. For the Lib Dems, Norman Lamb says, I have no objection to the other hospitals where there have been problems in the past, in the traditional way of running it. The official government line is that private solution should provide a sustainable future for the hospital. Susie.
Well, earlier I spoke to Phil Green from the union Unison and Mike Hewins from the patient group Link. I started by asking Mr Green what the union's concerns were about the takeover.
Well, we're concerned that it's the first step on privatisation of the NHS. We're concerned it's a very dangerous experiment. It's only been tried briefly somewhere else. It was an abject failure when it was tried there. And we're very concerned about the outcome both for patients and for staff.
But wasn't this conceived basically because of the dire straits the hospital was in, and they still have £38 million of debt? So isn't it better to have this kind of situation than no hospital at all?
It's better to have a hospital that's running efficiently. What has been shown up to now is with the new management that the hospital is running efficiently now. There is no suggestion in the franchising proposals that the franchisors are actually going to have to pay back this debt. In fact, the Strategic Health Authority have talked about, if necessary, they might have to subsidise them.
We've been in the hospital today and staff, I would say, were apprehensive but don't seem overly concerned about their future.
Well, there have been assurances given by the SHA that the staff will remain employees of the Trust. And that is something that we would obviously expect because it's still an NHS, it would still be an NHS Trust. However, there is absolutely no idea as to how the management of the Trust and the management of those staff is going to take place.
Mr Hewins from Link, if I can come to you, what are your concerns from the patient's point of view?
I think we are sort of reflecting very much the concerns of patients and local communities, and those concerns are very much around what services will be provided. Will there be a full range of services? What people want is a full range of services maintained, and they want improvements to those services.
But if it's actually written into the contract that they have to provide the services, then they will have to provide them, won't they?
Yes, they will indeed. I think at the moment, of course, bear in mind that we haven't seen a contract. They're not at that stage in their negotiations. So although they've been asked to sort of tender against a full range of services, they could turn around at some point and say, well, we can't achieve that. It's very difficult to see how any private provider can, in an atmosphere of falling funding, provide a profit, meet the full range of services, and possibly contribute towards this £38 million debt that you referred to, because that's certainly what's been in the original documents that have gone out to providers.
Mr Hewins and Mr Green, thank you very much. And there'll be more on that story on this weekend's edition of The Politics Show. It's on Sunday at 12 o'clock on BBC One.